Good morning. What brings you in today? Okay, so a bit of hearing difficulty. And what does that include? Any pain? Any ringing in your ears? Ringing? Okay. And can you confirm your date of birth? Just make sure. And you've been seen here before. I'm a new doctor here, so I don't think we've met. It's very nice to meet you. And is this in both ears or just one? Okay. And when did the ringing start? Okay. Have you had any past issues with your hearing? So you've passed all previous hearing exams. Okay. Any issues that run in your family? And when was your last ear cleaning? It's been quite a while? Okay, that's okay. I can definitely take a look today and possibly clean them for you. And then you said no pain. What about any pressure or any kind of feeling like you're underwater? Okay. Any discharge? And then what have you been taking in regards to medications? Okay, and then anything prescribed? Any allergies? Alright, so let's get started. I am going to start by just examining your ears. Put some gloves on. And you don't have to worry about this hurting. So I will first feel around your ears. Kind of tug on them, push on the areas around your face and in the back of your ears to just make sure there's no pain or bumps, anything abnormal. And then we will go from there. Sound good? Good. So I'm going to start with your left ear. And just tilt your head a bit for me. Perfect. Just going to start feeling. And any pain there? Any pain there? I'm going to pull down on your ear. Any pain? Good. I don't see any redness or discharge, but I will look more closely in a minute. Now just tilt your head the other way. Feel here. Pain. Good. Don't feel any bumps either. Just good. I'm just going to pull down. Any pain? Okay, good. So everything looks good so far. But next I'm going to look a little closely with my otoscope here. Just get a clean piece right here. And this just lets me see deeper in your ear canal. So I just have a little light here, and I'll be taking a peek. start over here. And I'll also be feeling around still a little bit too, okay? So, let's see. Okay, so I don't see any inflammation. Maybe a little bit of redness though. Just a little closer here. And do you clean your ears yourself? Yeah, I think you may have gone a little bit too deep. See a little redness in that one? Let's see this one. Yeah, I see a buildup for sure in this one. And that could be a cause of the hearing issue you're experiencing. It can also cause dizziness, pain. You said you haven't had that, right? Okay. Just checking the tympanic membrane right now. No fluid buildup. But yeah, I'll definitely have to clean this ear. I'll actually clean them both for you, but I think there will be a little more on this side. So, put this away. And we'll start the cleaning. Let's see here. What do I need? So I need some oil. The oil is really just so the earwax softens and I can easily get it out. So I'll be using that, and then a cotton swab to gently remove it. And I think that should be it. After I'm done, I will actually check them again and make sure they look better. Do you have a preference with what ear I start on? Okay, then I guess I'll just do this one first. Get the oil ready. And I'm going to need you to completely tilt your head to the side. I'm just going to put a few drops in. So head to the side for me. Good. 1, 2, 3. Okay. Let's take a look now. Just take a look. Okay. So I'm going to start right there. And you just let me know if this starts hurting at all, okay? Just going to gently get most of it out. Do you have any fun plans for the rest of the day? Nice, yeah. There should be some good weather coming soon. Totally looking forward to being able to be outside a little bit more. Okay, let me look again. Just a little bit more. That looks good. Much better. Okay, so that is good. And now let's do the next one. So you can just kind of press on your ear a little bit. Yeah, some of the oil might drip out, but there shouldn't be too much left over. And now we'll do your left ear. Okay, so tilt. Good job. one swab here. Let's look. So, I'm gonna start right here. Does that hurt? Okay, good. I try to do this as gently but as quickly as possible. I know it can sometimes be a little uncomfortable. This one doesn't have too much buildup though, like I said, so I should only take a few more swabs here. Let's see here. Yep. That one looks good. So you can kind of touch it a little bit if you want. And the rest of the oil will just drip right out. And then I have some tissues right there if you need any. Okay? And I'm just going to clean up, take off my gloves, and then we're going to do your hearing test. Let me just take a few notes so I don't lose track of what I've done. Let's see, I think I'm gonna do 4 to 5 hearing tests depending on how well you do. So we'll start with just a light tapping sound. So I'm gonna have you close your eyes. You'll actually be closing them for almost all of these tests. And I want you to tell me what side you hear this tapping sound on, your right or your left. Alright? Good. 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 Now tell me if you hear it close up or far away. Good. 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 So same type of thing now, but I'm going to use a different sound. So again, tell me if you hear it close up or far away. Good. 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 Okay. So I think I'll do the whisper test next. So I will just whisper 3 words. I need you to repeat them back to me. If you have any trouble, just let me know. Okay. Apple, blueberry, banana. Good. I'm gonna move to this side. Pineapple, kiwi, tomato. I'm just gonna do another set on this side. Pink, purple, blue. Good. Now, since again this was the side that was a little bit red, I'm going to do 3 more things, but a little further away. If you can't hear it very well, that's okay. I just want to test. Okay. 17, 22, 12. Yeah, that was a little bit harder, but it was meant to be. So it looks like your hearing is fine. How's your ringing right now? Any ringing in your ears? Okay, perfect. I think the last thing I will do is the tuning fork test. And have you ever had this done? Okay, so then you know what this is. And I'm just going to strike it, and you should be able to hear a vibration. If you could not hear it, that would obviously be a cause for concern. I'm going to strategically place this on top of your head and by your ear. I want you to tell me what is louder, A or B. Okay? Here we go. A or B. Good. And one more. Very good. Alright. So it seems like your hearing is fine. Although I will say I'm a little bit concerned about that redness still. So I'm going to suggest a few things for you. First thing is, monitor that ringing in your ear. If for some reason it were to come back, I want you to call me right away, and I'd like to see you again. I am hoping that the cleaning helped, but you never know. Good news is, I didn't notice anything else in there, so I think you should be fine. And then next, so I know you've been cleaning your ears by yourself, which is fine as long as you're careful. So I want you to start using a mix of 50-50 water and hydrogen peroxide. And you can either put it in a little dropper yourself or have somebody else help you get it in there. The idea is to really soften the wax and then just gently clean. But remember, you don't want to go too deep, just right on the outside. Okay? And once you put the drops in, I would just gently massage your ears so that it goes in, and then you can clean it. Now, any questions? So then I will either see you back next year or before that if you have any issues, but hopefully you won't. Do you want to schedule an appointment now? Okay. So I'm going to give this paperwork to my colleague who will take it up to the front desk, and then they will get you your bill if you have one. Otherwise, thank you so much for coming in, and hopefully your ringing will go away. But give me a call if it doesn't, okay? Perfect. Well, take care, and have a great rest of your day.